So thank you again, Dr. Ria, for being with us today. Why don't you start out by giving us a quick introduction about yourself and how you got to where you are today?
All right. So first of all, both of you, Vanshika and Nalin, thank you for having me, be here with you guys and to help you, all the students who really want to go into medicine, to pick up this career, which is actually a very nice and a very blessed career, I would say. So I'm Dr. Ria Shirsolkar. I am actually I'm a primary care provider, and I'm the medical director of Stonebridge Family Medicine, a part of Privia Medical Group. And so, with respect to my journey, I am a foreign medical graduate. So I graduated from Bombay. That time, Bombay, India, like Mumbai right now. And I came here and I came here for to do my master's in medical informatics. Um, Medical informatics was the field at that time. It was a very, very new field. It was basically how you can incorporate medical clinical skills and all the technology. So now we basically without technology we cannot do anything. But previously our clinical skill was the only way to diagnose a patient. So I really feel happy that I was a part of it. That when the electronic medical records was not existent, and I was one of the person who actually could get into and help with that technology part of it. Um, when I was doing my medical informatics, I also worked as genetics and researched into gene. Which was like an MTHFR and factor V laden genes. These are the genes which are responsible for having cardiovascular disease like heart attacks and strokes and diabetes. So it was all about research and how we could early diagnose these diseases and to prevent these from happening. So it was a lot of fun. It was very encouraging, but the only thing that was missing was the patient care. So that's when I decided, okay, I really want to get my clinical skills into consideration, and I started studying for USMLE. USMLE was a tough path. It wasn't as easy as I thought. I thought, okay, well, I was like freshly out of my medical school, so I was like, okay, it's not going to be very difficult to go and give my USMLE. Um, so I did give my first boards, my step one, and I failed miserably, really, really bad. So then I was like, okay, what should I do? Should I really pick this career, or because I was pretty much happy with what I'm doing? But still a part within me decided that I still want to pursue like a full-fledged medicine as my career. And I studied again, and then later on I just got a high score in upper 90s. So and that's when I decided, okay, I took my failure as my stepping stone to success. And then I applied into residencies, again, which was very difficult because being even if I had a lot of clinical knowledge here, and I was actually working with UMDNJ, which is University of Medicine and Dentistry in New Jersey. So I was actually doing all my work, working extensively with the doctors and the cardiologists there. But still, I think it was still a difficult path for me to get into residency. Then I got into residency at Virginia Tech, and after which it was I after which it was pretty tough during the residency, but overall it was a very blissful experience. And then after I graduated, I decided to work for, because I was with the Carilion Roanoke Medical Hospital, and this is a part of Virginia Tech. So then I decided I'm going to join all hospital-based clinics only. So then I worked for, my first job was with Valley Health in Winchester, as outpatient primary care. And I loved it, but the drive did not agree with me. So then I decided, so I worked for Inova for a short period of time, and that's when Novant UVA Health System happened. And then I joined Novant up until last year when I was working for Novant. Um, but due to certain reason, they had to close down the location, which was in South Riding, where I was working for past 8 years. And I did not feel it appropriate to abandon my existing patient population. So I just decided that I'm just going to uh, be a part of Previa Medical Group, which is more of a physicians based as opposed to a hospital, which is more of an administrative and business people. So that's why I decided that, okay, it's better for me to join a medical group where everybody makes a decision are doctors. So, and here I am.
Okay, that sounds great. So the next question is, could you give us a description about your typical day-to-day experiences in your field and what a normal workday would look like for you?
So, a normal work day for me as a primary care, I'm primarily outpatient. Um, so my normal workday begins at 8 a.m. and we see a wide variety of patients. We see from 0 day old, so I have newborns, to grandparents, to great grandparents, and I love my job because it's the entire family. We take care of the whole family. We do see a lot of diseases, a lot of patients with who has come with multiple issues. They would be coming in just talking to you about their shoulder pain, but then go ahead and discuss with you about their anxiety issues or the depression. We see a lot of I see a lot of obesity patients with diabetes or heart conditions. um, so being in primary care, we see a wide variety of patients and it gets busier through the day. But the beauty of it is it's the continuity of care that I love. And you keep seeing the patients, as if I now I kind of, when I see the patients, I kind of know their names. And I know their kid's name and I know their grandparents' name. So it's the beauty of it is the relationship and the trust that you build with your patients. So I really enjoy my day, even if it is a stressful day or it could be a very nice, relaxing day, which never happens, but still.
I loved hearing how genuinely you talked about loving the patient connections. That was really nice to hear. And I'm guessing if for anyone that goes into family medicine, that's what they're to expect, right?
Well, yes, and it all depends on, again, one thing I have realized through my experience is, when I was a new doctor, I realized that I was actually just telling patients, hey, because I had all the medical knowledge, it's like, okay, I'm going to give you this information and this is what you're going to follow. Now I have realized when I'm working as a primary care provider, my patients will, if I'm telling them, hey, you need to go to this cardiologist or you need to go see this doctor or any specialty, they go see the specialties and then sometimes they come back to me and they will tell me, hey, this cardiologist told me to do this, what do you think? So they are actually citing my opinion, although the specialist has definitely more experience than me. But what really matters is the trust. It's the trust and how you know the patient and for how long, right? And I really feel blessed, and I think that's the most important thing, that when my patient shows that trust in me, it helps me be better for myself and better for my patients. A lot of the times I'm telling them exactly what the cardiologist told them or exactly whatever the specialist has told them, because that's why we have been sending them. But I have realized that there's a lot of hand holding and a lot of like we say, the TLC, right? You have to give them in order to make sure that that care plan is taken into consideration. If not, if I tell you, Nalin, that hey, this is the medicine, you're going to go and take this medicine, I am not coming to your house to feed you that medicine, right? So it all depends on how much explanation and the trust that you have with your provider and how much trust the provider has in you, in order to, and a lot of the times I would know that if I prescribe X medicine to a patient, I'm sure that patient is not going to take it because I know what is their background. I would know that they may not have that, either they may not have that resources, or maybe they may not understand how to take the medicine. So sometimes I have to tell patients, come to the clinic, bring your whole bag of medicine. Let me just review that with you. Are you doing it right or are you doing it wrong? Writing down in their language that this medicine is for this particular thing. Maybe putting them in, a lot of the older patients especially are not technology savvy. So we have to actually give them in writing, send them, send my nurses home, or, home health care who can help them with those medications. So this profession is very, very rewarding, but at the same time, it will take a little bit of toll on you. But at the end of it, when you get the gratitude from the patients, it's very rewarding.
All right. Thank you for answering that question so well and going more into depth about how rewarding the experiences are. And I really love hearing you speak about it with so much passion. But anyways, for the next question, and you touched on this a bit, even when talking about your day-to-day stuff and how you failed that one exam, but then bounced back. In your experiences, what are some major challenges that you had to overcome, both on your journey to where you are and maybe what you face on a daily basis? And how do you overcome them?
Um, the challenges that I would say in my journey, um, I think the biggest one would be getting into residency. Um, Once you know that this is the career I want to pick, okay, it's very easy to say I want to be a physician or this is what I want to do. But to be very honest, it's like I told you, it's a rewarding profession, but there it is pretty stringent, and it will have its days when you may not be able to eat, you may not be able to have a bathroom break, to be very honest. Now I know times have changed, and when I was into residency, we had 36 hours on call. Now I know that that thing has changed and now it's 16 hours, but still that can be it can be really tiring at times. Okay. So I think those are the challenges that we faced, and I'm sure you will be facing similar. So you should be prepared that, hey, there would be days I may not be able to sleep, or there would be days I may not be able to do the things that I want to do. I may not have a weekend because I have to work on my weekend, and there would be all sorts of those days. But at the same time, when you would be helping that patient in the ICU, or helping that son to go back home, that blessings that you would get from the mother are way, I can't even tell you how gratifying that is. Okay. You would actually, not just that, sometimes when you see some sick patients and you realize how bad sickness has affected other people, you you would be counting your blessings. You would be knowing that where I am today, maybe I really have a tough journey, but I'm still blessed. So it would be, and I learn a lot through my patients. A lot of my patients will give me that information, and each day is a learning process. That's one thing that I would say that was during, it has been during the residency and even through now, that I feel that that's the challenge. The other thing I would say the challenge is administrative challenges, which, so between a doctor and a patient, I wish there was no insurance, but there is. If I have to order an MRI today, or if I have to order a CT scan today, a lot of the times the insurance will decline it. And that requires a prior authorizations. That requires a sorts of other things. Like if, for example, if I have to prescribe a medication, which would be expensive, maybe the insurance will not cover that medicine. And then that requires us to change that medicine. So all those things are the administrative challenges that we have. The same thing will go when you are hospital-based clinics. Then you would have other administrative challenges like the referrals, and there would be, like I told you, those your how many patients a day will you be seeing is more important than the quality of care that you provide to the patient. So you would have those challenges, but I think at the end of the you should not be afraid of these challenges and just go forward with it.
Yeah, we've heard a lot of healthcare professionals who've come to our meets. They've talked a lot about how administration's been so difficult because of these reasons. So it's interesting that you brought it up too. So the next question is, what is some information you think high school students like us should know before committing to this career path?
Like I told you, it's a journey that you can definitely walk the path, but remember, it's not going to be easy for you. Okay, as long as you are committed and you believe in yourself that you will complete it, it's something that you should pursue.
All right, so that wraps up some of our 4 standard-based questions. Now we're going to move on to student-submitted questions as well as some personal questions that we made.
Okay.
All right, so for the first one, why did you decide to start your own practice? And what are some unexpected difficulties you've encountered in this transition?
Um, Honestly, I never wanted to start my own practice. Okay, I loved my previous job with Novant UVA Health System. I can't even tell you how much I loved it. Okay, it was not something that I think starting my own practice came up as a all of a sudden to me because they planned to close down the location where I was working, and whatever was the logistic issue of a hospital-based practice, which I can't comment on. I just didn't want it to lose my patient population because, like I told you, Nalin, primary care is all about trust. If I have built the trust on my patient population, if I'm going to abandon them, they will have to find another doctor whom they will have to go for x number of years to build that trust with that physician. And it goes the same way with me. If I have my patient population, I know them for a very long period of time, I'm building that trust with my patients, right? So I just didn't want it to um, it was too much of disheartening for me when that location closed because I just didn't want it to lose that patient population. So that's why I just decided that I will just open up a practice which will be very close to, or at least work in a clinic which will be very close to this original location. And luckily for me, Novant helped me. They did help me pursue it too. So that was the main reason why I decided that okay, I want to be a medical director over here. And then the challenges that I experienced, I was not a business person. I'm still not. I do have a lot of good support from Previa Medical Group and from my spouse as well, who has been helping with the administrative work. Remember, physicians are not administrative people. We are clinicals. In our medical school, we do not have any lecture or any subject on how to run a practice, how insurance works. We have zero knowledge about it. I wish probably, hopefully, by the time you guys go to medical school, they would have a topic on it, but we never did. So we had no knowledge about how a visit is built. I have no knowledge how insurance works. So that was something that I had to learn. Again, I have not learned it completely because that's when Previa Medical Group helped me with it. At least they are taking care of that admin part. But that's one challenge that I had because I didn't have to do that with Novant, which I have to a little bit do over here with the administrative part. The other part was, of course, staffing. Luckily, I have a good nurses, a very supportive staff that has helped me through, and that has stick around with me from old time to now. So luckily, those all things came into picture, but it was just a learning process, and I think each day is a learning process for me. Each day we learn new things. Oh, this is how the insurance works. Oh, this is how I have to do it. Okay.
Yeah, sounds good. Okay, so the next question is, you've kind of touched on this. So, what are some hurdles you face as a woman in this field, and what is your strategy to face these hurdles?
So that's a very tough one, by the way. You really want the answer? I'll give it to you. But so I have to be brutally honest. This is a man's field. Okay. No matter what you do, Vanshika, you will, even if you are a stellar candidate, Nalin will always have an upper hand on you. Okay, because he's a man. But As long as you believe in yourself, and as long as you know that you have found your way, we women can take the world. Okay. When I still remember when I was in my residency and I saw a patient, I saw him, I spoke to him for about 25 minutes. I did a fantastic job. I came back and I spoke to my preceptor. I explained them everything. We went back in the room with this patient, and the patient addressed me as a nurse practitioner when I was an MD. And my preceptor, he corrected that patient. She's like, she's an MD. She's same as me. Okay, she's a third year resident. I'm an MD. I mean, I'm just like he explained it to her. And this has been happened to me multiple times when it doesn't happen to me now, but in the initial phase, that days like, oh, like you're not an MD, you're a nurse practitioner, which probably they say that if you're a female, you're supposed to be a nurse practitioner, you're not supposed to be an MD. But um, at the same time, as you keep going and as you start to enjoy your work and start doing it, it doesn't happen, and it really doesn't matter now what gender you are. It's that disparity is going to happen. You take it with a pinch of salt, you go away, you do your job, and make sure that you work harder and you do good.
And a follow-up question to that we've been asking a lot of healthcare professionals, what about any racial disparities you faced? I guess mostly on your journey to where you are.
Um, Racial disparities, I did not face so much, to be very honest. I have heard instances when other people have. Luckily, I would just say, I kind of escaped through it. I hope so. So not so much, and it's basically probably also because a lot of the doctors now are Indians, and or have been from other countries too. So I did not face as much. Um, and plus I was in more in in Northern Virginia, DC area. Even in Virginia Tech, I did not face as much of racial disparity. So I can't, but I'm sure if it would have been in some other part of the world, it may have happened. And again, like I told you, Nalin, or you shouldn't worry about these things. It really doesn't matter. If you do what you're doing and you love what you're doing, and you make this as your passion. Okay, if you stay focused, keep it as your passion, you're always going to face these little obstacles here and there, right? You're going to face, yeah, that some people are going to comment on, even if you are, say, even if you would be a Caucasian or you would be African American, they would comment on the way you look, the way you talk, the way what you are. As long as you know what you're doing and you are doing it right, do be righteous about it, you should be okay. You don't need to worry about these things.
Okay, so the next question is, how do you balance it all throughout your entire journey? How have you balanced it, and what do you do to ground yourself and keep going?
When you say balance, you mean work-life balance, or you mean balance with respect to emotional balance?
Everything all together.
um, Work-life balance is difficult sometimes. It can your work can really take toll on yourself at times, and especially when you're a physician, it can happen. You have to, and there is, unfortunately, we do not have a way of how IT people can do it. Okay, my laptop is shut and I'm done. We still have to be on call. We still can get calls in the middle of the night from the emergency department or from a sheriff office talking about a patient's health condition or something, or an ambulance call. We have all of these things. So um, I'm kind of being ready for it. So there would be days that I can feel, okay, I'm super tired, but like I told you, it is gratifying, right? I might have days where I have not slept, but next day in the morning I see this patient who's 82 years old and she's appreciating the way I'm taking care of her. That makes my day. It's okay. My night was stressful, but my day is nice. So it kind of balance it out that way. You need to take some time off to be with your family sometimes. And I do keep my cell phone on. So if there is anything, the patients can text me. A lot of my patients have my cell phone number too, and believe me, I have not got anybody who has been misused it. because it's a trust. So I really, really, I would not say that anybody has got, has really bugged me enough. That knock on the wood, and I hope that doesn't happen. So that's one thing. Emotionally, it can sometimes be very difficult. You can have a patient that you go in the room is sick with n number of conditions. He could be having, you have to break down a news to them, hey, that breast mass that we had, unfortunately it's stage 3 breast cancer. Or you could be having a patient with a colon cancer, pancreatic cancer, who you have to sit down, explain that, hey, you this is what it is. And it's difficult for us to do that because we with primary care, we see that first brunt, right? We are the one who, we are the first face that the patient face. So sometimes it's difficult for us to keep that calm. Then you go into the second room and you have a patient who's angry at you because you were 25 minutes late for that appointment. Okay, so you have to have a mood change. So you definitely will have a different personality meets. So you have to maintain that posture, maintain that emotion, and just go ahead with it. Or you would have a happy patient, or you would meet a fourth patient who would be furthermore depressed because of X number of things that has happened in their life. So you kind of learn through the process.
Yeah, I love how often you talk about how this is a learning process. And I guess it shows that even after you go through med school and residency and everything, the grind never stops. So
Yeah, it
I,
doesn't.
yeah.
And
All
it's
right.
actually, it's very, it's I think it is, the day you stop learning, you stop growing. So
Yeah.
it's very, very important that you learn each day. Every day when you learn, you realize that there are new things happening, right? And that's how we physicians keep ourselves updated too. Like only when we learn through, we learn about new medicines, new technology that's coming in, there are so many new things that we have to keep upgrading ourselves to.
Yeah, exactly. And looking at the time, those were all the questions we had to ask. So as we wrap up, do you have any last advice, tips, experiences, anything you didn't get to already mention?
I guess I mentioned a lot, but so if again, if any of the students definitely need any help, feel free. You have my cell phone number. You can forward it to them, and they can definitely contact me directly, and I can actually guide them. Doesn't matter whether what field you pick in medicine. It's extremely, I would say, rewarding profession. And each day you wake up, you're happy to go to work and you really really love your job. It's something that I look forward to. I do get stressed out. I do get upset at sometimes because, like I told you, if I have a sick patient, it can, it can affect you a little bit of work life balance, but you can manage it. It's not that difficult. But it's a very very rewarding and profession, and definitely the noble profession, as they say. But so I would just suggest that if you believe that this is something that you want to do, go ahead with it. Okay.